Hi, I'm Jordan McDonald, staff writer with GovCIO Media and Research, and today I'm joined by Dr. Neil Evans, the Acting Program Executive Director of the Electronic Health Record Modernization Integration Office at the Veterans Affairs. Thanks for joining us, Dr. Evans.
It's great to be here. Thanks, Jordan.
Appreciate you taking the time out. There has been a lot of really exciting news in the EHR over the past year. At the end of last year, you announced that the rollout would begin again in 2026 in a few sites in Michigan. And even early this year, there was the announcement of 9 additional medical centers for it throughout next year as well. Could you sort of just give me a breakdown of where we are in the process and how the rollout is progressing?
Yeah, absolutely. So I think first, what we're deploying, it's helpful to talk about what it is that we're rolling out as part of our electronic health record modernization journey. And we're deploying what we call the federal electronic health record. It's the electronic health record, the very, very same electronic health record that's currently in use across the Department of Defense's healthcare system, by the United States Coast Guard, by the National Oceanic and Atmospheric Administration, and is currently in use in VA at 6 of our VA medical centers, 26 of our community-based outpatient clinics, and then 104 other sites across the VA enterprise that support those 6 medical centers and 26 clinics. So this is a system that we are using actively in the VA. We also have an electronic health record that we have used for decades now, the Vista electronic health record, that is in use at all of our other sites. And we are committed to moving forward with implementing the federal electronic health record across all of VA. We spent the last few years doing some important work to prepare to accelerate our deployment of the electronic health record. And as you mentioned, we announced in December our plans to move forward with implementation at 4 sites in the state of Michigan. And we started that work in early January. And then we've announced a plan to accelerate our implementation at well beyond just those sites in Michigan, adding an additional 9 sites throughout Ohio, Indiana, and also including our site in Alaska, in Anchorage, Alaska, with plans to go live at all of those sites in calendar year 2026. But that's not where we're going to stop, right? We're already working on plans for moving beyond that and finishing our deployment of the federal EHR across VA as early as the year 2031.
Yeah, that's really exciting. The sites, Michigan, Anchorage, Alaska, Ohio. Could you sort of help me understand how those sites were particularly selected and what I guess the criteria was for site selection?
One thing that we have learned as we've been deploying and charting our path forward with implementing the federal electronic health record across VA is we've learned there have been some amazing best practices that we have been able to execute at our first 6 sites we've gone live at. But we've also learned a tremendous amount from our experience going live at 6 sites. We've learned from our partners in the Department of Defense. One thing that I think has been a real lesson is the value of we're moving from deploying at 1 medical center at a time. We started and deployed at the Man Grantstaff VA Medical Center in Spokane, sort of working 1 medical center at a time, to thinking more about implementing waves of medical centers, so multiple medical centers at one time, based on the relationships between those medical centers. So as an example, the Michigan medical centers, the 4 medical centers in Michigan, Detroit, Ann Arbor, Saginaw, and Battle Creek, these are the 4 medical centers. There's actually another one in Iron Mountain, but that's in a different network within VA. But those 4 medical centers, they work very much in an integrated fashion. Patients may receive their specialty care in Ann Arbor, but their primary care through the Battle Creek system, as an example. And so going forward, implementing and choosing a schedule that really captures those natural pre-existing relationships, we believe is an important part of the successful path forward. And that was also partly how we chose the sites that we chose. Regarding the sites in Ohio and Indiana, those are part of a larger network, our Veterans Integrated Service Network 10. And so by the time we are able to finish our deployments, again, in the Ohio market, the Indiana market, and the Michigan market, we'll have been able to complete an entire network and have converted them over to the new information systems.
It's really cool to see as you're talking about the regional connections between the sites and how you're using that as a, I guess, bellwether to see how the deployment's going. As that rollout does happen between these regional centers, what will you be looking for to, I guess, assess how well they're doing? What factors and the like?
I think it's helpful. Like an electronic health record, it's not just about a database that keeps track of electronic health information. It's a collection of health information technologies that are integrated together that really serve as the backbone of the operations of the modern medical center and clinic. So it's the way electronic health records not only keep the records around the patient's care, but also are how orders are placed. If I wanted to order an X-ray or a laboratory, how those results are reported back to the clinician, involves for the patient portal to allow veterans to be able to see their own health information, communicate with their doctors, right? It powers the relationships and the care delivery that are part of healthcare. And so when we think about changing to a new information system, changing from one electronic health record system to another, how do you manage progress is your question. Well, there's really two big pieces to it, right? There's a lot of technical work to make sure that the technology works. There's testing that we do where we have to test every build to make sure it's going to work properly when we go live with it. There's infrastructure work that we need to do to make sure that our IT networks have been upgraded sufficiently to support the new technologies. There's all that blocking and tackling from a technical work, and we pay very close attention to that. But there's just as much an importance of focusing on the human side of this, right? Because this is, the IT is there to enable healthcare delivery, and it is both veterans who are receiving the healthcare and our staff who are delivering that healthcare that we need to help navigate this change from the system they've been using to the new system. And so we spend a lot of time working and considering how do we help all the new users. And in VA's case, right, when you consider our staff as well as all of the trainees who rotate through VA on a regular basis, medical students, residents, it's well over 400,000 individuals who we're going to, over the course of this project, be navigating through that journey, that adoption journey. And that's something we pay very close attention to, right? Success is helping the new end users through the adoption journey, as well as delivering the IT with excellence and rigor.
Yeah, absolutely. And obviously, this whole system is for the veterans and the caregivers that serve them. So, could you help me understand like what specific feedback you're looking for from them? Like, what are you looking for where they're saying this is working for us and this isn't working? And then how are you hoping to respond to that as that happens?
IT systems should just work. They need to be up all the time, or almost all the time. And we care a lot about what the experience is, that users aren't experiencing an unacceptable number of hangs, crashes, lags, that the system is performing as we would expect it to perform. That's kind of like the base level of expectation. But then, we care a lot about our user feedback. And one of the things, we spent a lot of time over the last 2 years is listening to our end users at our live sites. So at the 6 sites that are live that I mentioned, 6 medical centers, and then the many clinics as well. Really understanding from them and hearing from them things that were working for them well in the system, things that were not working well for them, and responding to that feedback, making the adjustments and making changes to the system, revisiting some of the decisions we made as we started down this journey. There are literally tens of thousands of decisions that need to get made to consider how to configure an electronic health record. So what items go on this drop-down menu? Where do we, how do we organize folders to find certain forms that might be needed in the electronic health record? It's not an information system. The federal EHR is not something that you just take out of the box and press go and it's ready to work. And so we spend a lot of time listening to our staff, listening to end users, and identifying what is the best practice. One of the big changes here is that we're implementing a system that's an electronic health record that is an enterprise system. It will be the same regardless of what site a veteran comes to receive care at. And so that process of listening to our end users to determine what the best configuration is to support not just the end user there at, in Walla Walla, Washington, but what is going to be best for that person in Walla Walla, Washington, and the entire VA healthcare system. It's been actually really a great learning opportunity for us as a health system to navigate that journey together.
And, as you mentioned, learning opportunities, it brings me to my next question, which is, the EHR is already in deployment at a few sites. And we've talked about some of the changes that you're making in the future deployments. Could you sort of run me through some of the lessons that you've learned from those deployments already that you're bringing into the new sites as they roll out next year?
One thing we've learned is the importance of standardization. And by that, I mean sensible and appropriate standardization. That is, our prior electronic health record, the one that we're using, I shouldn't call it a prior, it's the one I use every week to see patients, Vista, allows for an awful lot of customization all the way down to the clinic level where folks can really decide how they want things configured for their own workflows. And that's been in many ways a strength of Vista. But one of the challenges has been that Vista is a collection of 130 different instances of the electronic health record that then have to work together. And there's sort of orchestration of figuring out how to make sure that the data around a veteran is not all in the same place and the provider has to go look for it in different views. For the veteran, actually, we're able to present it to them in a more cohesive sort of single view of their health records. But as we move towards an enterprise system, the importance of that standardization I mentioned before is something that's been a real important lesson for us to learn. And that standardization actually is a good thing. It allows us to provide better and more consistent support for end users when the system is consistent for them. It allows us to push upgrades faster across the enterprise. It also allows us to innovate faster when we identify, as we've standardized how we do things, when we identify a better way to do things, that innovation can then be spread nationally almost immediately. And so the importance of focusing on figuring out what our national standards should be within the electronic health record is definitely a lesson learned. Another lesson learned is the importance of empowering. It is really that this is an all-in approach. One of the things that we have learned in implementing support for the system is the importance of what we've implemented, what we call the tiered hub structure, but making sure that there are experts in the federal EHR at each of our facilities who are the first point of contact for end users who are having issues. A lot of time you need that local coaching and that local knowledge. And that, yes, there's a need for support at the enterprise level for an enterprise system, but there really is the need to build a structure to support this really across the enterprise from the front lines and then up from there. Uh, the third thing I'll say we've learned is the importance of engineering rigor. That is very careful attention to the technical performance of the system. We are now really at a point where we're tracking down very, very small performance issues that affect only a few users. But for those few users, those are significant challenges. But that requires, careful attention to detail with regard to the delivery of a complex set of IT capabilities, so engineering rigor. And then the fourth lesson would be around the importance really of never settling when it comes to improving how you support end users on the adoption journey, right? We've been tweaking our training. We've been considering how we empower super users to be there to support their colleagues as we transition. We've introduced new learning events called the Learning Labs, where folks can really get to sort of play around and understand the system before go live. We've continued to iterate on how we support end users with at the elbow support at the time of go live, really not letting up on that adoption support, I think would be another big lesson so far.
Yeah, that's great. You've learned lessons from prior deployments, but the EHR is also implemented by other agencies like NOAA and the DoD and the Coast Guard. Have you learned anything from them, and have you pulled and shared experiences as they've either finished their deployments or are also rolling theirs out?
I mean, absolutely, right. And I think we're not alone on this island, right? To your point, the DoD, NOAA, Coast Guard have deployed the very same system. It's the same database, the same their DoD users are logging into the very same system that VA users are logging into every day, as an example. So there's a lot of opportunity to learn from them, but also to learn from our private sector partners, right? This is not, we're not alone in going through an EHR transformation. This is the scale of what we're doing in VA is significant, but the experience itself is not entirely unique. So we are always open to learning and have learned quite a bit from our federal partners and actually from our non-federal partners. I think to give you the sense for the scale, it's worth maybe sharing a little bit. The federal EHR is currently, I mentioned where it's live in the VA, but within DoD, it's live at 138 military treatment facilities and a total of 3,638 DoD locations, all told. If we look in the U.S. Coast Guard, 109 U.S. Coast Guard sites and 7 sites for the National Oceanic and Atmospheric Administration, there are more than 9.6 million unique patients in the system and more than 207,000 end users of the system currently, if you look all told between all of the federal partners who are using the system every day. So the scale of what we're doing here is really significant. And so to your point, the opportunities for learning from each other when we're doing things at that kind of scale is also very significant. And we are always doing our best to take advantage of that.
Yeah, absolutely. And so to cap this all off, we've talked a lot about the progress you've made. I guess, what do those steps look like on the timeline as we get towards 2026 with the rollout, and then 2023 for 2031 for hopefully a full deployment of the system? Where do we go from there?
I'm super excited about the deployment of the federal electronic health record. Super excited about it. But what I'm more excited about is the value that we can deliver to our clinicians, our VA staff who come to work every day and use this system to do what? To care for veterans, and to care for their caregivers, right? That's really what matters here. This is all about the care of the veteran. And what is important is 2 things. We need to deploy the system, but we need to continue to optimize the system to meet the needs. Technology continues to mature. What we can accomplish using health information technologies is going to continue to improve as new capabilities, the artificial intelligence and others, are introduced. And so, a lot of what is in the future to your point, Jordan, is we have a lot of work to do to implement and deploy the new system. 13 sites in calendar year 2026 and many thereafter. We're also not losing sight of the importance of saying that this is also not just about deploying the system, but making sure that that system that we're deploying is ever improving to meet the needs of veterans.
Absolutely. So really excited to see the rollout over the next few years, especially next year. Dr. Evans, thank you so much for taking the time out. Appreciate it as always.
All right. Thank you.